can I do for you? Okay, you have an appointment with us? Great. What time is your appointment at? Okay. All right. Do you mind if I grab your primary and secondary insurance real quick? Okay, and I'll need a photo ID, please. Okay, thank you. Oh, thank you. Okay. I'm just going to go ahead and put these on the scan real quick, and then we'll get you all set up. Okay, great. So, what is your full name? Okay, and your date of birth? Okay, great. And that would make you how old? Perfect. What is your address? Mailing address. Okay. And a zip code? Alright, great. Who is your primary physician? Okay. Alright, do you know if they've sent any records over here yet? Okay, I'll just give them a call. Alright, have you been out of the country in the last 30 days? Great. Have you had the flu within the last 14 days? Okay. Yeah, we're still seeing a little bit of problem with that. It's just been bad this year. Okay. Do you have any health conditions that we should be aware of? This could be like any heart problems, asthma, emphysema, COPD. I don't imagine at your age that's true, but just for an example. Okay. Any types of cancers? Any diabetes? Autoimmune disorders? Okay. Alright, great. Do you have a family history of any heart conditions? Okay, your paternal grandmother, all right. And any respiratory conditions? This would be like your COPD, emphysema, asthma sort of thing. Okay, and what side of the family was that on? Okay, any cancers? What kind? Okay. And what side of the family? Great. Okay, any diabetes? Type 1 or type 2? Okay, and which side of the family? Any other conditions that runs on either side of your family? Maybe any mental health disorders or any sort of joint problems, any kinds of issues like those? Okay. Okay, on both sides of the family. All right. Okay, I'm going to hand you a couple papers real quick. So, okay. Here are your insurance and ID forms. Okay. Now this is going to be a consent to treat form. I'll just have you sign the bottom, read it if you wish. Okay. Great. Okay, and I have a financial responsibilities form. This is mostly just so that you are aware that you are responsible for any sort of bills, co-pays, anything of that nature. Right. I do have a form on that if you'd like to look over it. Okay, all good. All right. just have you sign right here and initial. Great. And we have a HIPAA information sort of brochure if you'd like to go through there. It's on our privacy practices. Just need to make sure that you're aware. Okay, well, I'll have you sign one more time. Great. So I'll go ahead and have you sit down. I'll call up your provider and get your records sent over, and they'll call you back when they're ready, okay? Okay, great. Hello there. Now, before we get committed, do you mind if I ask your name and date of birth so I can confirm that you are in fact yourself? Okay. Alright, would you mind spelling that surname for me? It's been a little bit of a long shift. Okay. Alright, perfect. And date of birth? Alright, great. Well, I'm going to be your nurse today. So, word is on the street that you are having a CNE today, is that correct? Great. Well, not to worry, it's a very minimally invasive process, so I'm going to get you all started, ask some questions, take some vitals, and then I'll hand you off to the doctor, and we'll go from there, okay? All right. Do you have any questions for me before we begin? Okay. Well, let me go ahead and sanitize my hands real quick. We'll dive in, all right? Okay. Okay, so I'm going to ask you a few questions and just answer as truthfully as possible, and hopefully we can get through this pretty quick, okay? Great. Okay, so do you have any current conditions, acute, chronic, anything of that nature? Even something so simple as a cold. Okay. All right, and how long have you had either of those? Okay. Okay. All right. Anything else that we should know about? Okay. And your current medication list, do we have that? No? Okay. So would you mind just listing all the medications that you're currently taking? Multivitamins included. Okay. And what is the dosage on that? Okay. Once a day? Alright. Taken in the morning or at night? Okay. Alright, and the dosage? Okay. Taken once a day, morning or night? Perfect. Okay. Do you smoke? Okay, and what does your alcohol intake look like in a given week? A couple drinks a week, a couple every day, anything more, anything less? Okay. Okay, and any illicit drug use? No, I'm not going to snitch, but it is helpful to know if you are on cocaine while we are doing this examination and you start seeing some things. I know that's not generally a side effect of cocaine, but if it is, you may want to wonder about what it's getting cut with, okay? Okay, no illicit drugs. Okay. Now, we're including marijuana, okay? Okay. Alright, just making sure you know. You wouldn't believe the people that would come in. No, I don't do any illicit drugs. Oh wait, does weed count? Yes, it does. At least for now. Okay. Perfect. So, my dear, I'm going to have you step over this way real quick. I have a scale, and we're going to get your height and weight, all right? Okay. Just wander right over here. Okay, and step on the scale, please. Great. And perfect. Now I'll have you press your back up against the wall. Okay. All right. We can come back here. All right. Get yourself all comfy, and we're going to go ahead and do your vitals, all right? Okay. Now I'm going to grab your temperature. I have just a little oral thermometer here. Let's go ahead and get a cotton pad, or rather an alcohol pad, out of the pocket. You wouldn't believe the things I keep in my pocket. You never know when you're going to need 20 alcohol swabs. Alright, my dear, let's go ahead and sanitize this real quick. Alright, just paying it forward for the next person. Alright, I'll have you open your mouth. Okay, I'm going to have you just lay this right there, lay your tongue on top. Okay, just hold it there. Alright, perfect. Okay. Let's go ahead and re-sanitize that. I will not be responsible for any outbreaks of oral gonorrhea. No, sir. Okay. 98.4 degrees Fahrenheit. Great. Alright, sweetheart, I am going to listen to your heart and grab your heart rate, okay? Alright, so I'm just going to have you kind of lower your shirt a little bit, and I'm going to press this on the top of your chest, okay? Let me go ahead and warm that up. Alright. These darn things can be so cold. Okay, just come in and listen. Okay. It's a good strong heart you got there. Okay, and down. Okay. And I'm going to come just around your side here. Just listening to the beat and the rhythm. Okay. Alright, perfect. Alright, sounds good and strong. Wish I had a heart like you. Yeah. Well, I've got something called, let's see, PVCs, preventricular contractions. My heart. Beats per minute. There we go. Yeah, it's not super serious, but when I got a test done, they had said my heart had beat 700 extra times, I guess. Or the ventricles contracted, but a lot of people have it. Not really that big of a deal. Okay, now I'm going to listen to your lungs. If I can get that. There we go. Alright, I want you to take a deep breath in for me, dear. And out. Great. Deep breath in. And out. Okay, other side. Deep breath in. And out. Deep breath in. And out. Alright, I'm going to sneak behind you real quick. Okay, deep breath in for me. And out. Deep breath in. And out. One more. Deep breath in. And out. All right. Great heart and some fine lungs to boot. You've really got it all. Okay. Let me go ahead and I want you to lay out your wrist real quick for me. I just want to take your pulse. Okay. 15 seconds. Yeah, this is a nice pause, huh? Okay, great. I'm going to check on your other wrist real quick. If you'll just lay it out. There we go. All right. It's a beautiful pulse you have. You should write that on your dating profile. My nurse said I had a beautiful pulse. It must count for something. Alright, there we go. Perfect. Alright. I'm going to grab your blood pressure, okay? And then we're going to go through a few more questions, and then you'll be all good to go with the neurologist, okay? Alright. Feeling alright? Okay. Alright, so let me go ahead and untangle my little sphygmomanometer here. Alright, dear, so what I'm going to have you do is go ahead and lay your arm out and just relax it. Don't hold it, just relax it down. Alright, do you have any preference on which arm? I assume the one you held out for me. Okay. Alright, let me go ahead and wrap that up. Is that firm? Okay, great. So I'm just going to go ahead and you hold that right there. Let me grab my stethoscope. Suppose it would have made more sense to put the stethoscope in and then go for it. But we're all out of order today. That is a-okay. Alright, dear. So I'm just going to put this in the crook of your elbow here, and ready to go? Okay. Okay. Let's go one more time. Okay, darling. Alright. Got that all nice and tight. Okay, blood pressure is looking good. Okay. So, my dear, as you are in for a cranial nerve exam and doesn't happen to be a quite often asked for experience, what made you make this appointment? What is your chief complaint? Okay. Alright. Post-concussion. Alright. Are you having any symptoms still? Okay, some headaches. Alright, are you noticing any sensory issues, any numbness, tingling, paralysis? No? Any weakness? Nothing else? Just headaches? Okay. When do they occur? Approximately time of day. Okay. And how long does that usually last? Where do you tend to get them at? Is it like in here? Is it here? Back of your head? In your temples? What kind of area? Okay. Okay, and how severe are these headaches? Okay. At a 1 to 10. Alright. So just more bothersome rather than worrisome. Okay. And so does this really impact your daily life? Not too much, just more annoying. Okay. Okay, great. Well, darling, we're all finished up here, so I'm gonna go ahead and grab our neurologist. She'll have to take a look at you, and that'll be the drill from there, okay? It was nice meeting you. Hope not to see you back too soon. Alright. I'll see you in a bit. Bye now.